Hello, everyone. Welcome to this week's COVID-19 housing provider sharing and problem solving session. Thanks for joining us today. I'm Torlin Wimbush. I'm Torlin Wimbush from All Chicago, and I have my colleague Jennifer Bravrini today supporting me for today's topic. I just wanted to welcome everybody to come today, and I want to go over some quick housekeeping rules. So if you want to unmute yourselves, you say your phone, but we're really asking everyone to stay on mute. If you're having difficult hearing, please join the webinar via phone. And for any questions, please put the questions in the questions/chat box. That will be able to support us today. Raise your hand if you have a question. As the presenters are presenting information, if you have a question after they're finished presenting, please type that information in the questions box. I'll take a look at that and share your question. Today's topics, we're having food and additional resources, and then we're going to have a wrap up and support next week's topics. And our presenters today is Clara Bowen from the Chicago Public Schools, Asia Kennedy and Pamela Horan-Bussey from Ounce Prevention, Shannon Parker from Howard Brown Health, and then we have our Jonathan Beavis from All Chicago that's going to be our presenters on today. So welcome all of you. I see our numbers are continuing to climbing, so we have a pretty busy schedule, so I'm going to go ahead and get us started and talk a little bit about our goals. All Chicago will continue to explore additional topics until May 28th at this time, so please remember to join us, and you can use the same login information as the COVID crisis that we will continue to build and explore together. I put a poll question inside the chat today. So to get your feedback, if you wanted to, what your thoughts are about extending our Thursday call throughout the month of June, a simple yes or no. So as you all log in and look in the chat, if you're able to put your response yes or no, I have it at the end, but I wanted to make sure I shared it with everyone at the beginning. So we're going to start with Claire Bowen from CPS. So Claire, you're up first.
Thank you. Can you hear me okay?
Yes.
Great, thank you. So I'm Claire Bowman. I am the Resource and Training Coordinator with the Chicago Public Schools Students in Temporary Living Situations program. And I'm just gonna take just a moment as we kick off here to talk about the CPS remote learning efforts and food resources that are available for CPS families. Next slide. So as you probably are all well aware, for the remainder of the school year through June 18th, all in-person learning is canceled, and all schools are continuing the school year with remote learning. Every school developed its own remote learning plan. So it's hard to speak to exactly what that looks like from school to school, because that is unique to each school community and was driven by principals, teachers, and other staff in developing what that looked like. But teachers, principals, or other school staff should have reached out to communicate with families about their school's remote learning plan and what the plan is for family-specific students at this time. If you're working with any family that has not had any contact from their school yet about remote learning, the best step is to contact that student's school directly. I've listed here the website where you can look up school contact information. It's the CPS school locator. You can also go to the cps.edu and just search for the school locator. Most staff are not in the building, but principals and other members of the administrative teams are still in the building, so the school's main phone number should work to get through to someone, particularly in morning hours. Around from 9 to 1 are typically the best hours to reach schools. Occasionally, there are school buildings that have been completely closed because there's been some exposure to COVID-19, and that closure typically lasts, I think it's 2 school weeks. So if that's going on and there's other help needed, I've got some further contact information at the end of this. But when reaching out to schools, Particularly if a family has not previously heard from their school, we recommend that they check what contact information they have listed for the family, make updates to that as needed, so that schools are able to stay connected, because we know that some of our families, keeping their contact information accurate can sometimes be difficult. I've also shared resources which you can access from the CPS website that kind of really cover the high-level basics of remote learning. So if you go to cps.edu and search for remote learning, you'll get to the remote learning homepage, and that will kind of summarize, what the current status is. There are non-digital packets available for all grade levels. They're continually updated on a weekly basis. They can be accessed from the remote learning homepage, as well as enrichment activities for students in addition to those non-digital packets. And there's also a really comprehensive document that's remote learning guidance for parents that really covers a lot of information that's helpful, sort of from what the expectations are. It covers what the grading looks like for students, and then just some helpful tips, around how parents and other adult caregivers can help support students with remote learning. Some of them are very simple around, trying to set a routine up or having a dedicated space for students to work, which with our housing insecure families sometimes can be more difficult than other families. So I definitely recommend checking out the remote learning homepage. Again, if you go to cps.edu and search for remote learning, it'll pull up all of these resources. Next slide, please. Another great resource that's available for all CPS students, and this includes those students who are enrolled in charter schools or option schools or other non-district managed schools, is that we've got free meals that are being offered for the duration of the school year. Meals are available at 275 school meal sites. It's really important to know and to share with families that they do not have to return to their student's school of enrollment to pick up food boxes. So a family can go to any one of the CPS meal sites, even if they don't have children at that school, to pick up boxes. This can be really helpful for families that may be struggling with transportation if their children attend a school that's not located near where they're living. Pickup of food boxes is Monday through Friday, 9 a.m. to 1 p.m. I think that the exception to that will be Memorial Day coming up, which would have been it's a day of no school, so the boxes will not be available then. But when we pick up, each student will, or for each student in the household, the parent will receive a box with 3 days worth of breakfast and lunches. Typically, these do require some microwave heating. So if you're working with families at a shelter or spaces where they may need access to that they wouldn't necessarily otherwise be granted, we appreciate sort of making exceptions to give them access to microwaves that they may need to heat things up, or to refrigerator space if necessary. There's a really handy tool on the CPS website to be able to look up an actual, based on an address, what the closest meal site is. That's, again, if you go to cps.edu and search for meal site, you'll find that information. And then if there are any families that you're working with that they're not able to get to a meal site, they have barriers that make it so that it's not possible to get to their closest meal site, they contact the CPS Command Center. The phone number for that is 773-553-5437. They can actually request delivery of meals. With the delivery, typically there is some prioritization, so it can sometimes be delayed. They won't necessarily immediately get delivery, but they can set up to be included in the delivery rounds if they aren't able to get to a meal site to pick up. And when picking up meals, families don't have to show any kind of identification or proof of their students' enrollment. They should be able, it's a very low barrier access to getting these resources. Next slide. And also specific to students who are enrolled in the Students in Temporary Living Situations program, this will include any student who is residing in a shelter or transitional housing or doubled up with friends or family due to the loss of their housing. These students have been prioritized to receive a computing device and an internet hotspot from their school. So the expectation is that they will be able to get some kind of computing device. This might be a Chromebook, it may be a tablet, a laptop, something of that sort. And if they need it, also an internet hotspot. So if they don't have Wi-Fi or reliable internet access where they're staying, this will give the student the ability to get online to actually complete remote learning tasks that they have. So I know that people on this call are working with families in a variety of living situations. Typically, if a family is in permanent supportive housing or other permanent housing types, they would typically not be eligible for STLS, but other student groups have also been prioritized to receive computing devices. That includes those who might be English language learners, certain grade levels like seniors and 8th graders to help ensure they're able to move on to graduation, and some other student populations. So if computing devices are needed, we recommend contacting the student's school. We can guarantee them for STLS students, and we're working really hard with schools to make sure that those are getting out the door and getting to students. So, if you are working with families that are in shelter and they haven't received these kinds of devices and they haven't gotten contact from their school about this, we'd appreciate it if you would notify our team. I've listed here our helpline as well as our general information email where you can let us know, if a family is struggling to get access to that, who would be enrolled in the STLS program. Unfortunately, for other students, we don't have the ability to guarantee those resources, but schools would be the best to follow up with to make those requests. Next slide, please. I've also listed here our contact information. We recommend, anytime families are having questions or difficulties, these are probably the best places for them to turn. For questions from any student or family that are related to general issues, the CPS Command Center has a great team staffing it. Their number is listed there. They also have an email address. Through the CPS Command Center, families can also be connected to the CPS Child and Family Benefits Unit, which will assist families with applying for public benefits. So if they need assistance with SNAP or medical card applications or renewals, that is the number to call for that as well. And then for questions related to the STLS program or STLS students, we have our helpline. This helpline is not being answered because we are all working remotely, but voicemails are being checked and returned Monday through Friday from 9 a.m. to 1 p.m. So do please leave voicemails there, or you can email our general information line at stlsinformation@cps.edu. And I'd be happy to take any questions that folks have.
Thanks, Claire. I'm just looking to see if there are any questions that are coming in.
Okay.
Give it a couple of minutes. I don't see anything at the moment. So thank you very much. And I just wanted to let everyone know that everything that they're going to see in today's presentation, I'm going to make a sheet with all this wonderful information that's shared by all our presenters, and I'll be sending it out in the email so that everybody can have access to this information. So I wanted to share that. But Claire, thank you so very much.
Absolutely, thank you.
Questions at this point, so thank you, be safe, and thank you for all you're doing.
Thank you.
So we have Asia and we have Pamela that are going to come in and talk to us a little bit about early care and learning. So Asia and Pamela.
Good afternoon, everyone. Thank you so much for having Pamela and I this afternoon. We will go ahead and get started with our presentation today because we know that the agenda is packed. You can go to the next slide. So today we're going to start off talking specifically about childcare and build on some of the remote learning resources that were shared in the previous presentation. Per the governor's executive order, the only childcare that is currently available in the state is childcare for essential workers. This means childcare can take place in either community-based settings or in home-based settings, only servicing families of parents that are essential workers. Effective April 1st, priority essential workers have qualified for the state's Child Care Assistance Program, regardless of their income, meaning that the state will cover all but $1 of costs associated with childcare. According to the governor's Restore Illinois plan, childcare will reopen in phase 4 of the 5-phase rollout. As we're currently in phase 2, it seems safe to assume childcare centers will not reopen at the end of this month. And understanding all of these changes are extremely challenging for both parents and children. And we did want to plug that there are a tremendous amount of mental health resources, which I've included in a one-page document that Torlin will also share out at the end of this presentation that families can access. These include a hotline that will connect you with a counselor within 24 hours, as well as a virtual mental health service from the Erickson Institute in both English and Spanish for parents and caregivers of young children. And I'll include that number in the chat at the end of this conversation. And lastly, the Governor's Office of Early Childhood Development developed an emotional well-being toolkit containing resources for parents and caregivers so they can start learning and engaging or continuing in their own practice of self-care. In terms of remote learning, per the governor's executive order, all public and private schools are to be closed for the remainder of the school year. This also includes all early learning and care settings. However, the state has asked that school districts and individual schools create remote learning plans, specifically stating that this type of learning may or may not use technology. The Chicago Public Schools has developed enrichment packets for those as young as pre-K. So we have packets for three-year-olds and above. These materials are available online. And the great thing about these materials are, regardless if a child is enrolled in a CPS program or not, they have access to these materials. Understanding the technological divide that many families face, CPS has been distributing devices to families, and as Claire previously shared, they've also shared hotspots. The state board has also issued guidance for families who may not have access to these hotspots that have been distributed by the school districts. They also have issued guidance on how to find mobile hotspot areas for those who may need additional access. For pre-K and younger, the state board has also issued the following recommendations for young children's time in front of computer and technological devices. And they've limited that at 60 minutes a day for no more than 3 to 5 minutes at a time. However, we did want to underscore that this is just guidance and families are encouraged to make the best decisions for their own individual needs. And my colleague Pamela will talk a little bit more specifically about our current Head Start and Early Head Start services.
Sure, if you could, there's the new slide. I just wanted everybody to know that children and families experiencing homelessness are always eligible for Head Start. That's something that's helpful to know. The programs that we have right now are continuing to virtually serve families of enrolled children during this time. So the children that were already either receiving home visiting services through their Head Start program or were in a center-based program that with wraparound childcare, they are receiving at least weekly contacts by staff, either family support staff or teachers, sharing referrals and donations. We have every Head Start program has a mental health consultant, and they are offering telehealth services to the families who are in those programs. And they're also, the teachers are sharing educational activities for the children in their classroom based on their individual needs. We're also sharing health information. There are nurses, nurse consultants at the programs who, for example, children who have a chronic health condition, the nurse checked in and made sure that, you know, they had a plan for getting medication, for example, for their asthma, and if they needed support with that. Also, you should know that, like, currently, usually you would go to Chicago Early Learning to get to help a family find early childhood education, home visiting or center-based. But right now, because of COVID-19, that's not open. But you can, my contact information is available if there's a family that needs support with virtual early learning. Like, coming up in the not too distant future, we're looking at how to start connecting with families who are interested. Next, go back to you, Asia.
We did want to reiterate that our home visiting services for pregnant women and children will be continuing virtually. These resources are always available, and if you want further information on how to access these services, please reach out. We can give you detailed information per program. Center-based programs are also reaching out to our families weekly. Some have been doing weekly story time and YouTube videos with teachers and for their students. We also have a pilot program out of the Ounce of Prevention Fund where we have a home visiting for families experiencing homelessness. We have 2 homeless service providers who are part of the project Facing Forward to End Homelessness in Primo Center. As a part of the project, they have staff who function as home visitors who are trained in the parents as teachers home visiting model. Those home visitors deliver home visits to families living in their shelter facilities. So not only do these homeless families receive case management from shelter staff, they're also receiving home visitors from the home visiting staff. Facing Forward families live in scattered site apartments, so those families are receiving virtual home visits, whereas Primo Center is a family shelter where they're still receiving face-to-face visits, practicing social distancing. And again, if you have any further information for us on how any of your clients or programs can be supported in their early care and learning space, please reach out to either Pamela or I, and we'd be happy to connect you with the right folks.
Wow, so thank you, Asia and Pamela. That was awesome. Thank you for this information. Really appreciate it. I'm going to see if we have any questions coming from the attendees. I don't see anything at this point. I don't see any questions, but if there are some additional questions, I'll definitely make sure that I share it with all the presenters. So thank you so very much. And we're going to have Shannon come up and share a little bit about the COVID-19 community response. So Shannon, are you there?
I am here. Can everybody hear me?
Yes.
Great. Well, hey, y'all. I am Shannon Parker with Howard Brown Health. I use she, her pronouns, and I am the Director of Strategic Partnerships for the organization. Next slide. So, like so many organizations here, Howard Brown has had to be rather nimble and proactive in their response to the pandemic. And in this presentation, I'm going to highlight what our COVID-19 response is. So to just name a few, we've launched a COVID-19 hotline. This can be accessed Monday through Friday, 10 a.m. to 5 p.m. and Saturdays, 10 a.m. to 3 p.m. Also, we're ramping up our telehealth visits. Reason being is because, well, we want to make sure that our patients are still being seen for their various needs, but are doing so in a way that is safe, practicing physical distancing guidelines, and are just keeping in alignment with state and federal requirements right now around the pandemic. Next slide. So I'm going to talk a little bit about the community care stations that we have set up, but going back to where I highlighted the COVID-19 lines, patients with mild or moderate flu-like symptoms should, to the best extent possible, remain at home. And we want them to utilize that number before actually coming up to the community care stations. Why? Because what it does is it ensures, well, it does it, well, hopefully it ensures less crowding at tents. And again, we just really want to reduce unnecessary travel for our patient and community base to keep them as safe as possible. So that number's right there. Next slide. And here are some of our other community care station sites. Our Hyde Park location at 55th, our Inglewood location at 63rd, our Rogers Park location at Clark, Howard Brown Health Halsted, and Howard Brown Health Sheridan. So all of these spaces right now are doing community testing. I'll get into this a little bit further, but you do not have to be symptomatic. And also too, you do not have to have doctor's orders in order to be tested. So I'll talk about a little bit of that as we go. Next slide. Also, too, some of our more exciting partnerships, not to say that our other work isn't exciting, but some of our partnerships right now is looking like us partnering with Project Vita out in Little Village and partnering with Task Force Community Services, which is in the Austin neighborhood on the city's west side. We are testing there from 10 a.m. to 4:30 p.m. and on Saturdays from 10 a.m. to 2:30 p.m. And again, same protocol. You do not have to be symptomatic. It is no fee. There's no fee associated. Community members simply get there, line up, get tested. It's very simple, low barrier access. Next slide. So to get into some more of the meat and potatoes of what we've been doing in order to provide community access to testing. In partnership with Mobile Care Chicago, Howard Brown Health has been providing mobile screening 3 days a week, particularly to high need underserved communities. You know, these look like people who are just not mobile and are vulnerable populations, particularly those who are in retirement communities and unsheltered individuals. Also too, as I kind of said earlier, our priority locations of the mobile unit is going to the south and west sides of Chicago, again, where those numbers are really skyrocketing, where people have historically throughout this pandemic have not had the same equitable access as other individuals. And again, the days of those mobile operations are as listed, Thursday through Saturday from 10 a.m. to 2 p.m. Next slide. So just to give you a little bit of a snapshot, through May 6th, Howard Brown has actually tested nearly 4,000 individuals, and we have diagnosed 837 positives. And we have done some, and the tests have shown individuals Can folks still hear me? All right, I feel like we're having a little difficulty right now. Torlin, are you still there? Okay, it seems like we are back to the Howard Brown slides. Torlin, I'm not sure if you want me to proceed from here. Hello, can somebody give me a signal that folks can hear me?